Hello everyone. Today I will discuss about an important topic of all India NEET examination. This topic is come in your all India examination plenty of times. So the question for this topic is a 4 years old boy 10 kg suffering from recurrent pneumonia. He was admitted 4 times in the last 2 years for the similar episode. His chest X-ray shows consolidation on the left lower lobe. When we take the biopsy from the consolidation, it shows aspergillus growth. The child had also suffered from gastric outlet obstruction for which surgery has done. He had multiple episodes of E. coli positive UTI for which he was admitted and treated with parenteral antibiotic. His HIV profile is negative. When you do the nitroblue tetrazolam dye test, it came positive. So what is the disease the child is suffering from? Options is SCID, Bruton's agammaglobulinemia, CGD, that means chronic granulomatous disease, and hyper IgM syndrome. In this question, we are seeing that the child is suffering from recurrent pneumonia and the HIV profile is negative. That means the child is suffering from some primary immune deficiency. The child has an atypical organism growth in the lung and also suffering from some E. coli positive UTI plenty of times. That means the child is suffering from catalase positive organisms, catalase positive organism causing new infection plenty of times to the child. And in the question, it is shown that the child is suffering from child having nitroblue tetrazolam dye test positive. So in any question, if this option is come positive, that means nitroblue tetrazolam dye test is positive, is saying in any question that think about chronic granulomatous disease. And as the name suggests, there is a granuloma formation. What is the granuloma formation? In this question, it is shown that the child is suffering from gastric outlet obstruction for which surgery has been done. And this obstruction is due to the granuloma formation. So what do you mean by chronic granulomatous disease? This disease is due to the defect in the activation of NADPH oxidase enzyme. And what is the role of NADPH oxidase enzyme in the primary immunodeficiency? This NADPH oxidase enzyme is mainly produce the HOCl, that means hypochlorite, and also kill the bacteria. How? When virus or bacteria enter into the body, it stimulates the neutrophil to enter into the site of inflammation or site of the infection. Thus, virus or bacteria then enter into the neutrophil body. In the neutrophil, they produce the phagolysosome. As I said earlier, this phagolysosome then stimulate the production of NADPH enzymes by stimulating the four proteins, that is GP91 FOX, P22 FOX, P47 FOX, P67 FOX, and lactogene proteins. These are the proteins we stimulate by the phagolysosome and we stimulate the NADPH oxidase enzyme. This NADPH oxidase enzyme then make the oxygen to produce superoxide, and by the superoxide dismutase, this superoxide produces the H2O2, that means, and this H2O2 is attached with the chloride ion and produce the HOCl by the myeloperoxidase enzyme. This HOCl, that means this hypochlorite attached to the bacteria and kill the bacteria. So by this way, the body kill the bacteria in the neutrophil. So if there is a problem in the NADPH oxidase enzyme, then the oxygen cannot produce the HOCl. That means either superoxide or peroxide, hydrogen peroxide, or the HOCl. So the body cannot produce this pathway, and the neutrophil cannot kill the bacteria, and the body is suffering from infection. This patient is mainly suffered from catalase positive organism. The catalase positive organism mainly causing the pneumonia or any infection to the child. What is done by the catalase enzyme? This catalase enzyme makes the H2O2 to produce H2O and oxygen, and the body cannot, the neutrophil cannot produce the HOCl. That means hypochlorite. So, if the catalase enzyme is positive for any bacteria, then this pathway is also hampered. So, as the NADPase is also defective, so this pathway cannot go on, and the body cannot kill, the body cannot, the neutrophil cannot kill the catalase positive enzyme, because the H2O2 is also produced by the virus or bacteria in the neutrophil. This H2O2, which is produced by the virus or bacteria in the phagolysosome, that can dissolve by the catalase enzyme, which is also produced by the virus or bacteria. So if the body, if there is a catalase negative organism enter into the body, the bacteria produce the H2O2, which cannot dissolve by the catalase enzyme, because the catalase enzyme is not present in catalase negative organism. Neutrophil can kill the bacteria by producing the H2O2. So the child is suffering from catalase positive organism only. That means, what are the catalase positive organism? The organism which are catalase positive are mainly E. coli, Aspergillus, Serratia, Staph, Salmonella, and gram-negative organism. So these are the catalase positive enzyme. The child is suffering from this catalase positive organism only. The child cannot suffer from an infection by catalase negative organism. That means Streptococcus can kill by the bacteria. As I said, there is a defect in the protein which is stimulate the NADPase oxidase enzyme. So it is an X-linked recessive disorder, and we can see also autosomal recessive disease also. GP91 FOX is the most common protein which is defective, and this is X-linked disorder. After that, P47 FOX gene defect, or P22 or P67 FOX gene defect, also causing this chronic granulomatous disease. As the name suggests, the child is suffering from multiple episodes of recurrent pneumonia, or any deep-seated abscess, or any GI infections, or any infection in the body. And this child is also suffering from granuloma formation, because there is a granuloma formation, and inflammation is the hallmark of this disease. So what is the granuloma formation? Granuloma is mainly formed by the infectious process, and granuloma is mainly formed in the GI tract, or ureter, or bladder, or any rectal fistula that can be seen in this child. So the child may suffering from pyrolic obstruction, bladder obstruction, or ureteric obstruction, or renal rectal fistula. The child is also suffering from Crohn's disease, and the serology for the Crohn's disease is also positive in this patient. So, if any patient is suffering from multiple episodes of recurrent deep-seated infection or pneumonia with any outlet obstruction, then think about CGD. So, investigation of choice is flow cytometry using the dihydroreductase enzyme to measure the oxidant production through its increased fluorescent when oxidized with H2O2. That means we give adding oxidase H2O2, and we see the how much body produced how much the body produced HOCl. If body cannot produce HOCl, then the child may suffering from chronic granulomatous disease. So flow cytometry is the with dihydroreductase is the investigation of choice. Nitroblue tetrazoleum dye test is the screening test, and if any question, this option is, you have seen this line, then think about CGD, chronic granulomatous disease. And ESR is a marker of the disease regression. That means, as the name says, there is a chronic disease. So chronic infection causing high ESR. So if the ESR is high and the child is suffering from some deep-seated infection. After that, after we giving the antibiotic for treatment, if the ESR get low, then that means the antibiotic is working successfully and the disease process is decreasing. That means the infection is decreasing. If the ESR is not decreasing after giving the proper antibiotic, then think about the child is suffering from infection that is not sensitive to the antibiotic. So course of antibiotic and the treatment and any deep-seated infection is mainly seen by the ESR. If the ESR is high after treating and giving antibiotic, then think about some any atypical organism like Candida infection or Aspergillus infection. So we have to give itraconazole or fluconazole for the patient. And the treatment of choice is HSCT, that means hematopoietic stem cell transplantation. So if any question, it is seen that the child is catalase positive organism causing pneumonia or any infection, and along with this nitroglycerin tetrazoleum ditest is positive, think about CGD. Thank you.